Good afternoon. I hope y'all all doing well and hope you had a blessed Easter. Obviously, it was the most unusual Easter I think that any of us have spent. And so we'll get right to it. You may have heard through some various channels of communication, there's discussion going on right now with the Unified Command. And the Unified Command consists of Commissioner Ludgood, Dr. Bert Ishow, and myself. And we formally have stood that organization up in order to collaborate as we move forward through the rest of this pandemic. One of the topics of conversation had to do with what we're continuing to see in the big box area. And specifically, we're not seeing the ability to social distance. There are counts going on, and some of them, matter of fact, I think all of them are counting the number of people they have in there. Some are specifically limiting less than the stated percentage. But in this morning's conversation with Dr. Ishow and Commissioner Ludgood, we are talking about, at this point in time, reducing the occupancy to 10% of the stated capacity in the big boxes as well as our grocery stores. And the way this would work is that the three of us agree with this. Dr. Ishow would actually sign the order, and it would include not just the city of Mobile, but Mobile County. The Unified Command will also address all kinds of other issues that we see, whether it's in the city or whether it's in the county, and we will probably jointly make recommendations as we move forward on probably almost every issue. You know, some of the conversation that I've been participating in and that you're starting to hear on the national scene is, you know, how do we go back to work? I mean, what does that look like? And almost all the energy resources, everything has been into controlling, getting to a point where we have the social distancing and the stay at home. But there is starting to be more thought about what does it look like going back to work. So earlier today, in a conversation with the Chamber of Commerce, trying to give them just a specific thought is that each individual business needs to start thinking about what would they do to start back up, knowing what they know about the social pressures to maintain social distancing and the stay-at-home order. Now, they're not going to determine when they open back up, but every one of them needs to have a plan, and as they share those plans, that information will end up with City Hall, it'll end up with the County Commission, Dr. Ishow's office, and ultimately the Governor's office, so that you will see a grassroots effort on trying to determine, you know, what does it look like going back to work. And I don't have any idea when that will be. I just know that the conversation has started. We continue to be grateful to the Salvation Army for what they're doing with the homeless. I think we have fulfilled our part of the obligation of getting the sanitary items to the 3 locations so that that population can at least have sanitary conditions to live by. Great news that you saw that Frontier made an announcement. They will be coming back to Mobile, flying out of Brooklyn, and we'll have a flight every week to Orlando, which is something that we wanted when they were flying to Chicago, Denver, and we wanted Orlando also. I wish they'd come back and said they were going to fly to all 3, but obviously with the airline industry being what it is, that's what they could do, you know, in order to give us something to get back in business at Brooklyn. Tremendously grateful to Frontier for doing that. Also, we have been able to procure additional testing kits through Synergy Labs, who actually got them from McKesson. And these are the rapid serum test or the antibody test. And so we will start testing selected members of our public services and public service workers and Parks and Rec. And I'm waiting really on a list to come to me from Colonel DeLapp, who's the Director of Public Works and Parks and Rec. And these will be individuals in those two parts of the city that we feel like are coming in contact with either things like garbage and packaging, or they're serving food. So anyway, we'll start that here in the next couple of days, and all that testing will be done at Brookley. At this time, we have Dr. Brian Summerall with us. He, if you recall, he was at Spring Hill Memorial, and about 10 days ago he was here and was telling you he was thinking that we were going to be on an upward trend. I think he's going to tell you today that he's actually been on duty for the last week, and he's seen that upward trend. And everybody knows, I think you should know by now, we are thinking this will be the peak. I mean, this is the peak that we should see everything moving up this week, hopefully to start going in the opposite direction, either on the 18th or the 20th. So, Dr. Summerall.
Good afternoon. As the mayor said, we definitely saw an uptick in COVID cases in the hospital this past week. I was on for the past 9 days, and actually through today, and we had a marked increase in our inpatients. I believe we are currently, and this is without the numbers that came back today, but I believe we currently have 25 inpatients that are COVID positive. 10 of those are in the ICU, and we have more tests coming out today, so that number may actually go up. It's impossible to tell at this point whether this is the peak. I pray it is, but regardless, if we're not there, we're headed that way. I know I sound like a broken record when I'm up here, but I would advise everyone to keep doing what you're supposed to do. Please stay home. Only go out if you need to. You have to. If out, stay away from other people. Wash your hands. I know everyone's getting tired of hearing it, but there's a reason we keep saying it. The reason that we have managed to flatten the curve is that people have been doing that. So just because maybe we're getting close to the peak, that does not mean that everyone just should go nuts and forget about that. We will see where this takes us. Rest assured, I've been in touch with my other colleagues at Mobile Infirmary in Providence, and I can assure you guys that people are being taken care of. As of this point, the hospitals have not been overwhelmed. We have the supplies we need. The horror stories that y'all have heard coming out of New York and Baton Rouge have not hit here. I do not believe that is going to be the way it is here. We're obviously being careful with supplies, not being wasteful, making sure we have as much as we need so we can keep going with this. And we're just, like you guys, we're kind of taking it as it comes. And my prayer is that we are getting at least close to the peak of this, but everyone needs to know that we are not close to being done with it. So everyone just needs to keep doing what they are doing.
Any questions of myself or Dr. Summerall? Yes.
Got a few for you.
Oh, come on.
I'll start here. We're hearing, and I think maybe this is stuff for Dr. Summerall or Mayor, you both. We're hearing about lots of furloughs happening at some local hospitals, but we've gotten no response every time we've reached out. Have you heard of this? Has anyone heard of this happening?
I've not heard. I've not had that conversation with any of the CEOs of the hospitals regarding furloughs. No. Are you familiar?
I've had no direct conversation, obviously, with the administration about any kind of furloughs, but I've also heard no one complaining about being furloughed, and that usually is something that would be in at least in my hospital, that's usually something I would have heard about if nurses were being furloughed or stuff like that. As far as going down the line of different parts of the hospital, I couldn't speak to that. So.
There are 18 reported deaths here. We're leading in Mobile County. We're leading the state in the number of deaths. Should that be a cause for concern for people here, or is it just maybe because we have people with existing conditions now and anything as a doctor?
Obviously, I don't like to hear that we're leading in death. It's not something that I'm excited to hear by any stretch of the imagination. I would say it's impossible to predict out without having the data laid in front of us exactly, comparing the patients they've had at different places compared to the patients we have had here, ages, comorbidities, so on and so forth. It's almost impossible to really tell where that's at. And this is, I can speak for the care we're giving. We're pretty much following the standard of care that's being done around the country in care of this patient. We actually had the advantage of being a few weeks behind these other places that were really having to figure it out on the front line. So we were taking advice from other critical care physicians about what they were doing and what they were seeing that works. The most frustrating thing about this disease is the fact that you can cross every T, dot every I, do everything you're supposed to the nth degree, and the patient just gets sicker and sicker and sicker in front of you no matter what you do. And that's what is so scary about this disease in general. Now, this, once again, that is not every patient. Everyone needs to be clear about this. The vast majority of people who do contract this will be okay. But for those people who get very, very sick, they get very, very, very sick. But as far as taking it, somehow trying to say, why is it down here? I don't know. I don't like it, obviously. And we'll have to kind of wait and see as the trend goes on whether that balances out. But as far as giving a reason, I don't believe there's any way to do that. That's just Spring Hill Hospital. That's just Spring Hill, yes.
Well, can you talk to, I guess, because the way they classify it, some people are hospitalized, they haven't been tested. Are you guys seeing that where you're waiting?
So basically, whenever anyone comes in, and I'm speaking just for Spring Hill here, they have I'm sure I've seen the tent outside the emergency room. They get triage in the tent, okay, and they determine whether they likely have COVID or don't. And then they look at them and say, do they need to be admitted to the hospital or not? If they think they likely have COVID, they tell them, you probably have it. Go home, isolate, stay away from everybody if they're healthy and they feel like it's safe to go home. If they feel like they need to be admitted, they COVID test them at that moment, and they get admitted with kind of a pending COVID test. And we've had a better turnaround. Our turnaround's gotten closer to 24 hours now with getting our test back. So we're able to kind of turn around pretty quickly and say whether they're COVID positive or not. And then hopefully, and we've also, talking about the people who have come in and done poorly, it's important to know that we've had lots of people who've come in, COVID positive, gotten better and gone home. Okay, that's also something important to remember in this. This disease is not a death sentence. I mean, it's something you obviously don't want to have, and it's dangerous. But we've had lots of people come in and go home. But as of this point, we have 25 positive. 15 of those would be sitting not in the ICU, but on the normal hospital floor. But we have multiple ones that are pending, and unfortunately, those results are going to come back this afternoon. So we probably have more than that at this point, but that's the number I have as of this morning.
Is that still the case?
Yes, it is. We've, well, and this goes across, the country. There's no elective surgeries being done. Okay, so that empties those beds out. For whatever reason, our census has just been low regardless. I don't know if that's because of self-isolation, people aren't getting as sick, or aren't having other problems. But we've had lots of empty beds. We've had plenty of beds to open up to keep the COVID patients in, basically. And obviously, we're keeping them in completely separate units away from the rest of the hospital.
There's pretty much a blanket policy for no visitors during all this.
Yes.
What if a child contracts this, a teenager? Would their parent be able to come see them?
So we don't do, well, we don't admit pediatrics at Spring Hill. That'd be a question you'd have, I think children's and women's would be the only place you could really ask that to. I mean, I don't know. No, excuse me, I do know that. If they have COVID, no one's gonna be allowed. Because even there's reports, I believe we had one here at I may be wrong on this, but there was a newborn who they were concerned had it, and they had to isolate the newborn from the parents, which is awful, but it's necessary because you don't want the parents then getting it and then getting bad sick or something happening. So it's horrible.
You guys would not accept a patient like that?
No, we don't admit pediatrics now.
We're hearing across the country that hydrochloroquine is being used
Yes.
in patients who are exhibiting symptoms of COVID.
Mm-hmm.
So this is kind of a two-part question
Yes.
for you. Is that being used here for patients? And then also, we're hearing that it being used more is creating a shortage for people who use the same medicine for things like lupus and arthritis. Is there a shortage here?
Not that I'm aware of. Now, I can only really speak for Spring Hill. I don't give, well, I have a very small population that's on Plaquenil, like a very, very small population. In the hospital, we're fine. And we are not using it on everyone who comes in. Okay, the vast majority of people who contract COVID do okay with it. They don't require a hospital, they don't require oxygen, they don't require going in. And in giving them Plaquenil is not going to change the course of the disease. We try to save it for people who are requiring oxygen, basically who are a little sicker than the ones that are going to do fine on their own. I have heard rumblings of shortages, but as I don't prescribe that medicine, I don't really want to speak to that. We are not giving it out just ad nauseum to anyone who comes in the door that we think has COVID. Yeah.
Last week we saw, specifically in the IHME model, there was a big drop in projections for LVL. In the actual hospitals, does that change anything as far as the way you're preparing?
No, we are hoping that we are very overprepared. We are hoping that when we get done, we have tons of PPE left over and that we never reached a point where we were scraping the bottom of the barrel to get it done. We prepared like it was going to be a worst case scenario. And we like anything else, we pray. It's like prepping for a hurricane. You know, you prep and prep and prep and you pray it just misses you, or if it hits you, it's a Category 1 instead of a Category 4. It won't change anything, especially since we still don't know what's going to happen here. Like, I'm really praying and hoping that we're approaching the peak. But, you know, we braced ourselves for weeks and weeks and weeks not knowing when it was going to show up, and it finally showed up last week. So I think it would be it'd be a bad idea for us to let our guard down now just because some numbers have come back. Which, listen, I'm happy they're down, obviously, but we want to stay prepared.
Well, Baylor Burger said that they can have upwards, if really needed, they can convert to upwards of 250 beds. What does it look like in Spring Hill? What's the max you guys can have for COVID?
Well, so as of right now, we have a 10-bed ICU that is open for COVID unit. We have another ICU that's 10-bed that we can easily open up and move to more COVID floors. If need be, we can use ER beds to do it. As far as an exact number of beds, I don't think I can get into that. That includes the floors. As of now, we have, I believe, somewhere close to 40 beds we can use for non-ICU COVID patients. And we have multiple other wards we could open up if we needed to. As far as giving you an exact number, how far we can go, that I can't tell you, but, oh yes, yes.
We've heard reports, not at Spring Hill, but at other hospitals, of PPE shortages directly from people who work there, making healthcare workers have to reuse their masks. Are y'all providing fresh N95 masks to healthcare workers daily?
Yes.
And how are you guys kind of working to prevent that shortage? Is any of this happening?
Not yet. Definitely. As of now, from the reports I've received from administration, we are not in any danger of running out of N95s. They've been stocking up for quite some time, getting ready for this. Once again, like I said, we had a big advantage having this several-week period to kind of get ready for it. We have one distribution center where employees come and get their N95 mask every day. It is a fresh N95. No one's having to reuse masks. And no one's having to reuse gowns or gloves or anything like that. So as of right now, there has been no issue with that.
Is that just for Spring Hill, or are you speaking to?
I'm speaking. I do not know about the other hospital. I'm speaking just for Spring Hill at this point. So. Not that I'm aware of. No.
Yeah. The question is, would it be helpful if I had more resources, more data? I'd like to know if there are hot spots for locations of the virus. And the answer to more data is it's always helpful to make better informed decisions. And the Mobile Health Department actually does give it out by zip code, but they have to reach a certain number of cases before they will divulge that. And I think they're getting close to the point now where there are enough cases spread around so that it will not allow someone who's looking at the data to specifically say, you know, it's right here at this house. This has been explained to me. But we're hoping that that we always have more data to make the decisions with.
Do you know how much the testing kits are? Do they have any cost to the public? And then also, how much do testing kits cost the city?
So that's a varied. There's two kind of testing kits. There's the rapid serum kit that's about, let's say, $15 in the neighborhood of $15. Then there's the PCR kit, which is the nasal swab. I think that's about $75. Blue Cross reimburses maybe in the neighborhood of $50 for that. So what is the cost to the city? Right now, my understanding is that we're paying for the rapid serum test or the antibody test. I don't know if we've incurred any costs having to do with the PCR. I don't think we have. And we have a standing order for the next few days to Synergy Labs that we will take upwards of 600 kits a day until we feel like that we have enough test kits of the rapid serum, either to divert them to somebody else. But the primary thought process was, let's get enough for our first responders, and really first responders, and that may include the county also. And then then it would be the healthcare providers, the nursing homes, and so kind of on a betting on the what was coming down the road, as we didn't want to miss the opportunity to put an order in for those kits. So probably later part of this week, when we feel like we have sufficient kits, we'll tell Synergy that let's stop right there and let them sell them to somebody else. But we will be flush with kits by the end of this week.
For patients, though, is there a cost for them to get this test done?
There's not a cost. If you don't have insurance, it is not going to cost you anything. I mean, you can drive into Ladd Stadium, and if you have an appointment, and if you pass the questions, through the question sieve there, then you will be able to be tested, and it won't cost you anything. If you have insurance, that'll apply against your insurance. Did I answer your question? Okay.
Do you know how many of those tests the city has performed at those locations?
I don't know. Director Barber would know that. I do know that we've done the 900 having to do with our first responders that he's talked about several times last week. And when it comes to the public service workers and the Parks and Rec, you may be talking about a couple of hundred, another 250. A little bit of a guess there, but that's about how many more you would be looking at.
I was going to ask, and I know you talked about this a couple times last week, dealing with hazard pay. We saw the county roll back their pay because they started looking at some of the long-term costs.
Yeah.
Where is the city at on that discussion? Has anything changed?
There's not any more discussion really going on at this point in time, and that has to do with the 2 letters that I received from the fire chief and the police chief, and they both said that at this point in time that their men understand the nature of this situation, that there's not an end in sight, and that they are not looking for the mayor or the administration to stand up and give them hazardous duty pay.
With, as he's saying, no end in sight, has the city come up with a decision about maybe furloughs or layoffs of city employees? Is that still?
That's still just a conversation. Yeah, still being researched. Somebody made a comment, I think, Dana, you did, about the mask. You get a lot of unusual calls during times like this. Well, I got one from Chief Seeley, or actually it was in a meeting when we had all the city leadership, the department head speaking today, and he said he had found, I think he described it almost as a trailer load of masks, but they were old, and the elastic on them had dry rotted. The mask was still good, but his wife and daughter had spent the weekend taking rubber bands, and they rescued 500 of those masks to be used. It's probably not something that you want to use in a hospital, but he is getting an inventory right now to determine how many we have, because there's a way to maybe take an elastic strap with a little alligator clip on either side of it to use that mask in most any situation. So I'll be real interested in seeing what that inventory is, and we're grateful to his wife and daughter for being ingenious enough to figure out how to do that.
I actually saw over the weekend on social media there was a woman who brought her child into the pediatrician for one of the antibody tests just to see if maybe they had already had it and it built up the immunity. Any speculation on how far out we are from something like that?
Well, that's what we have now, but before everybody can be tested, you're a long ways from that. You have to have, like in the county of Mobile, you have to have 414,000 kits, if you're going to test everybody. And then to think at the end of not at the end of the day, but a week or 10 days from now, when there's been a lot more tests done than have been done today, if some of the national numbers are right, less than 0.3% of people are going to be COVID positive, and 98% of those that are going to recover. And so as we get further along, people will, in my opinion, this is something I've read, people will get desensitized to the fear of the COVID virus. We're not there yet. I mean, people are still, frightened about it, but there'll come a point in time when they realize, you know, I need to get on with my life. And it's just like in Mobile, we don't live in fear of hurricanes. We prepare for them, but we don't let it control our life. In Kansas, they don't let tornadoes control their life. Right now, COVID is controlling our life, but there'll come a point in time where we either have enough, where we've developed a vaccine, or we have enough of the malaria drug, or we have enough respirators where people say, you know, let's keep our social distancing, let's be smart about this, but let's see if we can't ease back into some normalcy of life. There are a lot of people who need surgeries, elective surgeries, that are not being done now. And these are heart patients. These are all kind of patients. And they can't just continue on indefinitely not doing elective surgeries.
Mayor, you said that Dr. Eichel would be the one to do the store capacity
Yep.
in Mobile County. Has there been any talk of possibly limiting the purchases to essential items only? I think you made a comment about that on the conference call today. Is that something that's also being
Yes. Yes. And your question is, your comment is, would it be that those shopping in the big boxes would only be able to buy essential items? Is that correct? Is that your?
Yeah, I mean, you guys
Yes, there'll be. That's part of the conversation that Commissioner Ludgood and Dr. Eichel and I will have tomorrow morning.
so that no decisions probably going to come out today for any.
I don't think they'll. He may sign something, but I think it'll be tomorrow before he would do that.
You mentioned trying to get back to normal. I know nationally some of the discussion has been about having testing after our heat goes down so we can get to where we are. Is the city talking about continuing to get these antibody tests or do that after we kind of come over the hump?
So the comment is the city thinking about having additional antibody tests so that once we pass the peak and when it looks like we're going down, can we do more testing to make sure that we're safe? And I'll use an example. I mean, would you want to let a restaurant have them so that the people going to that restaurant know all their servers, you know, are not infected? You know, that's an example I would use. Again, it's going to depend on the number of tests we have, but as I made a comment earlier, is that we have told Synergy Labs we'll take 600 tests every day that they can buy them until we say stop. And the idea is so that we have a stockpile and make an informed decision on how to distribute those tests so that we can, when the time is right, and it's not today, when the time is right for us to start easing back into this, into normalcy. Yep. Everybody good? Hey, thank you for your time. Appreciate it.